think we'll go ahead and get started. I don't know if, I guess I'll introduce myself. Hi, everybody. My name is Abby. I am a palliative social worker and a trauma therapist in New York, and I specialize in working with people with neurodegenerative disease and serious illness and end of life and caregivers. I'm on faculty at NYU, and I'm really excited to be here. I was here last year. How many of you were here last year at the bereavement workshop? Oh, good. So a lot of this will be new and surprising for many of you. I'm excited to be here and talk to you all about grief, specifically as it relates to prion disease, as it relates to CJD. My specialty is in traumatic grief, and I would say about half of my patients are dealing with neurodegenerative disease and caregiving of some kind. So if you, I don't know, so the presentation from last year is online on YouTube. I went more into like the theories about grief. This year, I thought we'd make a little more warm and fuzzy, as far as grief can be warm and fuzzy. And so I'll talk for about 40 minutes, maybe, about grief, and then we'll have about 20 minutes at the end for people to ask questions. If people would like to share a little bit about what they're dealing with, or they just have any questions about grief, I'm happy to answer it. Just, have space and hold space here in a beautiful way, hopefully. So we'll go ahead and get started. I think this is how this works. So we're going to start with, this is actually a quote from one of my favorite patients. So in addition to teaching, I have a private practice and I see patients dealing with traumatic grief. And this is one of my favorite patients. They're all my favorite patients, but this is one of them. And she has this tendency of saying her experience in these really beautiful, striking ways. And so I'm using her quote this year. I used the same one last year. Most of the slides are different, but I'm using this quote. And she said, "Everybody dies in the middle of someone else's story." And that really struck me because she is the last person in her family to be alive, right? She's at this place. She's the last person. Her husband died of a neurodegenerative disease, and all of her siblings and her cousins, everybody is gone. She also said, "There are more people in my head than there are on this earth," right? So she speaks very poignantly about her grief. But what I like about this quote is it acknowledges, right, that what grief means is that our story continues even after somebody died. So somebody dies, and it is in the middle, whatever the middle means, of our story. And so when we're going through this presentation today, I want to acknowledge that for some of you, this is an academic interest, and for some of you, it's very personal. And so you may notice throughout the presentation that you may be having feelings that are coming up, things that are reminding you of your own grief, your own experiences, and I would just invite you to hold space for them as gently as you would like to. And I guess I just want to acknowledge that many of you may be having very personal experiences. My hope is not to bum you out. I try to be pretty entertaining about grief and death, but to also be able to share some information that will be useful for you as you navigate through this. So the presentation will be going back and forth between information about grief and sort of check-ins. And what I will say when we're doing the check-ins, it is really important that we recognize that nobody has to go into their feelings in this moment. This may not be a safe place to do that. You may be in conference mode. You are not in be in your feelings mode. That's totally fair. These may be questions that you just make mental note of as opportunities to check in later. Some of you may decide to use this as an opportunity to check in with your internal experiences, but my hope is to help you both cerebrally and emotionally sort of make sense of some of your grief and what you might be going through. So we can understand grief. I talked about this last year in a more theoretical sense in terms of ambiguous and concrete losses and physical and symbolic losses. And I want to make this a little more personal. We understand grief on a lot of different dimensions, right? Grief is this awareness that something has changed and something is gone, right? It is this period of time from the moment that you are aware that something, that now you're in an after, right? There's a before and an after with illness. And most of us can identify the time when the after starts, right? And from that point onward, right, we're grieving. Because the life you thought you were going to have, the future, all these different things have changed. And so when we're in this point of this after, right, the first minute, the first decade, whatever it is, our grief is happening on a lot of different levels. And so the grief starts on a very personal level. Who was I before? Who were we before in terms of your relationship to the person who has died? Who was I in the before times, before the after? What is it like to look back at who I was in the before from this place right now in the after? Who were we, right? For people who are actively caregiving now, for people who are in bereavement from caregiving, following some caregiving, or from people who are in bereavement and the decline was so quick they didn't get to caregive, the transition period might have been more quick. When we are in this place of grief, we are also saying, who am I now? How do I make sense of who I am? How do I make sense of who we are? These things have all been, these things are all shifting, right? When somebody dies, we don't stop having a relationship with them, right? They might stop having a relationship with us, but we don't stop having a relationship with them. We still have an emotional connection, an emotional attachment. Thoughts about them will still evoke emotional responses within us, right? We continue to have a relationship. Who am I and who are we? One of the things that makes grief sort of tricky on a lot of different levels is it's not just the person you lost, but how do I make sense of the world? Does my world still make sense without this person in it? How do I understand the natural order of things? Is the world a fair place? Is the world a predictable place? Do I have control? Do I have influence over things, right? How do I make sense of my place in the world? Does the world feel unfair and empty, right? So it's both the loss of the person, but for many people, it's also this shift in their sense of the whole world, right? This very existential experience. Coming with that then goes into, how do I feel about the future? What does it mean to me to still be alive when somebody is gone, right? And so when we're looking at this experience of grief, it's not just, I'm gonna use air quotes, not just the loss of the person and how much we miss that person, but sometimes we also miss ourselves. We also miss a world that made sense, a world that felt benevolent, right? And I'm noticing as I'm starting to talk about this, folks are reaching for tissues, and so I want to acknowledge and honor that. We had this conversation last year that I will never hand somebody a box of tissues because there's an implicit message that you should stop crying, right? And I'm naming it now so that if anybody's feeling self-conscious about it, I want to acknowledge that at almost every table, somebody is having a viscerally emotional reaction. And so you are in community and you are in company right now of people for whom this is hitting home. And so we're going to intersperse me talking about this in sort of an academic way, as I mentioned, with some more experiential pieces. And so one of the things that's really helpful for grief is understanding that grief is normal. Grief is typical. Grief is not a problem to be solved, right? If somebody has depression and somebody has anxiety, that is a problem we try to fix, right? If you have depression and we're treating it, our goal is less depression, right? You have a score of this on a depression scale, we want you to have a lower score. Our goal of grief is not less grief, because grief is this acknowledgement that you have lost something very important, right? It's to help you cope with grief, to make sense of grief, to figure out how to carry it as gently as possible, sure. But our goal is not necessarily less grief, and so a lot of times what helps people the most in grief is increasing their capacity to feel their feelings. And when you go through a big trauma, when you go through something major, these major medical things, your capacity to feel your feelings is shrunk, right? You have to protect yourself. You can't feel all your feelings during a trauma. That's not a thing people can do. And so in the grief, a lot of times what we're doing is trying to increase people's capacity to let the feelings back in, right? Because people can process their grief. One of the things I always like to mention, I'm from the South, and where I'm from, we don't get to talk about evolution as much as we want. And when I'm here, I live in New York now, I get to talk about evolution as much as I want. And so from that perspective, 106 billion people have ever existed. Almost none of them had a grief therapist, right? The collective human experience has some capacity to deal with grief. And so if we can help people recognize what it is that they're feeling and tolerate their feelings and find connections and find community, most people, that's what they need to deal with their grief. And so some of these questions are going to be your touchy-feely questions. And so for those of you who would like to drop into their experiences right now, I invite you to. Those of you who want to take a dispassionate curiosity, I invite you to do that. People who want to tune out for a little bit and think about what you're having for dinner, I support that as well. Whatever you need to feel safe in this experience is fine. I never want there to be like implied social pressure that everyone has to have feelings at the same time. So how do you know what you're feeling? Most of us are not trained in our childhoods and in our communities to know what we're feeling all the time, outside of like annoyed or hungry or tired, right? Most of us are pretty good at those. But to really be able to track on a smaller level, when am I mad? When am I angry? When am I sad? When am I fearful, right? And so a lot of times you say, well, what am I feeling? I don't know, I'm fine. I don't know, I'm sad, I feel bad, right? We don't really, it's a practice to learn to track what we're feeling. And so these are some of the questions we can use to start to build that practice of recognizing and learning to tolerate what it is that we're feeling. Very few people know what they're feeling all the time. I imagine you would get very little done in life if you were tracking your feelings all the time. It is totally fine to come in and out of feelings. The hope is that you can drop into the feelings when you need to, and then drop back out when you need to go live your life, right? What do I notice in my body? For most of my patients, for most of my colleagues, if I say, what do you notice in your body? I don't know, I'm fine. Nothing's happening inside, right? If we just ask ourselves gently, unless we have a big reflective practice or we are athletes and something used to be tuned into our bodies, we don't always immediately get an answer to that. But I would invite you, if you are participating in this part right now, to take a moment and notice and just check again and scan and just notice any part of your body that is holding some energy. And maybe there's a tightness, maybe there's a tingling, maybe there's a heaviness somewhere. And it doesn't have to make sense in your head of why is this feeling here. But our feelings are physiological experiences first, right? They happen in our brain physiologically before our mind makes up a story about what it is that's going on. And so all of our feelings start in our body, right? We just learn to tune them out. And so if you can, different times during the day, during this presentation, what do I notice in my body? There's a little tingling in my hands, or some tightness in my chest, a pit in my stomach, a heaviness in my shoulders, a tiredness behind the eyes. And just noticing it without having to make sense of it, without having to give it words or a narrative or justifying it, but just acknowledging it as your body holding part of this experience, right? What do I notice in my heart? I mean this in the metaphorical heart, not the actual heart. I guess unless you actually know where your heart is. What do I notice in my thoughts? And this is just an opportunity to really reflect and check in. For some people, they reflect in images or sensations. For some people, they notice urges. I want to get up and run. I want to go do something. I want to distract myself. I want to reach for something, right? For some people, they're making meaning. Oh, there's a pit in my stomach. Why am I so nervous all the time? This is wrong. This is bad. I should be over this. I should be okay. Oh, this feeling's going to come up. I'm not going to be able to handle it, right? I need to push it down. Whatever meaning it is that people have. The other question we're asking ourselves, can we check in for more than a quick moment? More than just, what am I feeling? Fine. Upset. Right? Can I give myself more than a moment to check in with what I'm noticing inside, and can I be compassionate if all I get at first is a flicker of a feeling? Right? If you're not used to your feelings, you're going to get a flicker, a little moment of a feeling. That's okay. Right? And so these are questions that you may ask yourself now. You may think about asking yourself in general, but part of building a reflective practice is be able to notice the ways that we hold on to grief. Because everyone in this room has been through some kind of adversity or trauma, there's some sense from your body that going towards these feelings is going to be too much, right? Some part of you had to lock this down to get through diagnosis and treatment and figuring things out and handling all the things that you had to go through and all the things you had to handle. Some part of you had to lock this down at some point, right, to cope. You had to, you're people, this is what happens. And so expanding that capacity and opening it back up again, right, it could be a slow process. If you're trying to label your feelings inside, I had a lot of fun with clip art on the train on the way down here. I don't usually do clip art, but I was like, some people are going to be overwhelmed, and clip art will be helpful. So these are the clip art options. If you're noticing anxiety and shame and guilt, these are social emotions. These are not survival emotions, right? These are social emotions that come around as a result of my sense of my relationship to another person, right? Shame is somebody else is going to judge me, somebody else is going to think I'm doing something wrong, I think I'm doing something wrong, right? These exist only in the context of social relationships. If we're noticing these are sort of the slightly more surface level ones, I ask people to try to look underneath that, right? And what are the emotions that are more evolutionarily driven, the things that propel us towards adaptive actions? Anger, sadness, fear, excitement, disgust, and joy, sometimes even just having a list of the emotions and just running through them. Do I notice some anger? It doesn't matter, could you rationalize in your head and does it make sense and should I or shouldn't I? Anger says there's a boundary that's been violated and I'm feeling overwhelmed by that. Anger sets a boundary. Is there some anger? Yes, no, whatever it is. Sadness, fear, excitement, disgust, and joy. And sometimes what we have are secondary feelings about the grief. We might notice the grief. The grief may come in waves. It may be a pit that's always there, a burden that comes from over the shoulders, wherever it is that you experience it. It's also useful to check in about how do I feel about my grief. When I notice my grief there, is it, oh good, that's my connection to this person? Is it, oh no, the grief, this is going to be too much? Is it, oh, the grief, is it ever going to go away? Right? We have all these feelings and thoughts and analyses and assessments about the grief. And it's just as important to notice how do we hold the grief as much as the grief itself, right? Because it's going to change over time. So this is one, just to sort of acknowledge for folks, may hit close to home. And so some of you may stay totally present for this slide, and some of you may check out a little bit in your heads, and everything's okay, whatever you need, however you want to connect to this. A lot of what we're talking about is when we make the transition from being a caregiver to being somebody who is grieving. And you are grieving from the moment of diagnosis or the moment of symptom onset, whatever it is. And when I say griever, I mean in a post-death state, right? When you don't have caregiving as the main action and the main way of relating to somebody. And so the experience of caregiving has different meanings for different people. I am of the belief that I never use the term loved ones as a default. Most people who are caregiving have some sense of love for the person they're caring for, but not everybody. Relationships are complicated, people are complicated. People caregive for reasons of duty and values and responsibility as much as it might be pure and bridled love. And so caregiving has different meaning for different people. Whether this person took care of you, whether this was a mutual relationship like a partner or a sibling or a friend, or whether this was a caregiving relationship like a parent or a grandparent or an aunt, uncle, what it means to have received care from this person and what it means to now be in charge of care for this person is going to mean different things to different people. For some people, it's redemptive. It's like, oh, this is a chance for me to show all these feelings that I didn't get to demonstrate in other times. For other people, it's going to bring up a lot more complex emotions. But for everyone who is a caregiver, and whether the person was in the hospital the entire time and you didn't do the physical hands-on care and your job was emotional support and advocacy, or whether you were doing the hands-on care, it is all caregiving, right? You are all involved in the care of the person, even if it's not the physical care. But all caregiving changes the relationship, right? It changes the narrative of who you are and what the narrative of the relationship, and it changes your sense of identity. And the hard part, or one of the hard parts of the caregiving, is that these things are all changing at a time when you don't have time to process that. You don't have time to acknowledge it because there's all these things that have to get done with so much more immediacy. And sometimes it's not until later that you realize, oh, wow, what did I lose? What really happened here? And so some people were caregivers for a really long time. You know, when I'm working with folks who have like an Alzheimer's type and they have 5, 10, 20 years of caregiving, obviously that's a very different caregiving relationship than folks who have such a rapid progression, right? When you're looking at weeks or months, or the person is already unrecognizable by the time you get a diagnosis, right? That's a very different kind of caregiving experience. But these shifts have changed. When somebody, I use the term care recipient, which sounds kind of cold, but it's just because I don't like the default for loved one, because I feel like it cuts off a lot of conversations. So when the person you're taking care of dies, right, whatever it is that meant to you to be caregiving, your feelings for that person don't leave when that person dies. But your ability to act on that care, to act on that love, if love is part of it, that has changed. And so what happens for a lot of folks with grief is, where does the love go? Where does the care go? How do I still take care of this person's energy and their memory? I still love them, I still care about them, but I can't do anything about it now because they are gone. And so this transition is really hard, right? Because in addition to missing the person as a whole, missing whoever they were to you, there are some people who miss caregiving. There are some people who miss that experience of having something to do, having somebody to give, right? Even if intellectually they are able to say, this was their time, I'm glad they're not suffering anymore, whatever narratives they're telling themselves, there are some people who miss this experience as well. Because to be in a state of grief is to deeply acknowledge that this person is gone, right? And that is that takes time, right? This is not something that most people do the first day. This is something that can take months and years to really let that sink in. It usually happens piecemeal. And so making this transition is hard, because what does it mean to continue to live, right? One part of you is holding on to this person and what they mean to me in the present tense, what they meant to me before, what it meant to care for them, and then this other part of me is still alive and still living. And how do you hold space for both parts of these experiences? So you're getting 2 charts now, right? So I know that slide might have been tough for folks. So now you're going to get some cerebral stuff. So maybe pull you out of your feelings a little bit, maybe drop you in more, we'll see. One of the best ways, I think, to understand how to organize this transition, right, from caregiver to the state of bereavement, how to organize your grief, is to be able to track where you are in your nervous system, right? And this is all based on, if you were to Google polyvagal theory, you would find 1,000 charts that look like some version of this. So if this one doesn't resonate, you can find other ones. But how do we track where we are in terms of how receptive we are to taking in feelings and to connecting? Ideally, we would spend most of our lives in a grounded state, right? And in this grounded state, it doesn't mean everything's happy and hunky-dory all the time, but it means we are in a place where we can handle our feelings. If we are mad, we can acknowledge the anger, we can get support for it, we can do something with it, we can be curious, we can be compassionate. In a grounded state, we have what's really important, which is relational attunement. And that means we can take in from the people around us. And so if somebody is giving us love and care, it's not just an intellectual acknowledgement that somebody wants to take care of us, we can actually feel it and take it in. If we are not in this grounded state, we might notice that somebody's trying to be nice to us, but it's not going to land. And we'll talk about these two different zones that we get into. And this is why it's really important for grief to sort of recognize when are we in this grounded state when we can feel our feelings and how do we get out of it. So in a grounded state says, I feel safe having my feelings. Whatever my feelings are ones I can handle. I am connected to people. I'm connected to myself. I am safe. I can handle these things, right? This is one of the ways I like that they describe the signs is that you can feel and think simultaneously. Right? It's not just an intellectual acknowledgement that I'm sad or going through a hard time. I can feel it. I can acknowledge the thoughts and the feelings at the same time. Right? That's how you know you're in this grounded state. In this state, we can take in. This is what's really important. We have relational attunement we can take in. We can notice if we're hungry or thirsty or have to go to the bathroom. We can notice if we feel loved and cared for. We can look with compassion with our own experiences. Nobody can stay in the grounded zone all the time. This is not a thing human beings can do, right? We all move in and out of different states. We all have to, at certain points, activate and take our nervous systems up a notch and be able to block out certain parts of our experience. So one of the things we do is we go into hyperarousal, which is the fight or flight zone. And if you imagine you're facing down a bear, right? When you're facing down a bear, you don't want to be paying attention to how do I feel about the people around me? And look how beautiful the mountains are. And am I hungry right now, right? This is not a good use of our energy. We're focused on there is a bear. There's a bear. We need to, don't take my advice about what to do with an actual bear. So this is hypothetical only. I need to run away or punch the bear. Don't do that, whatever it is, right? But we are blocking out so much of our experience so that we can focus on, marshal all of our energy on keeping ourselves safe from this threat. And from this place, we feel pretty powerful. I have something I can do. I can fight, I can flight, I can flee, I can do something, right? I can do something. This is something where we are marshaling our resources to get stuff done. Caregivers know this state really well, right? Family members taking care of people who are sick know this state really well. They will spend a lot of their time in hyperarousal. A lot of us with busy, stressful jobs, I don't have one right now, but when I used to have like working in the hospital all day, right? Running around the whole day long. I wouldn't have no idea that I went the whole day without eating or going to the bathroom. And then all of a sudden at the end of the day, I have a headache and I'm tired, I'm cranky, and it's like, oh yeah, I haven't had any water in 8 hours, right? Hyperarousal, you're running around, you're getting stuff done. In this state, we lose relational attunement. I'm not going to pick up on the emotional nuances of other people, and I'm not going to be able to take in from other people when they are trying to take care of me and connect with me. It is a very lonely state. It is a very difficult place to be in. For many people, it is a safer, I'm using air quotes, a safer place to be in, because when you're in this state, you feel powerful, you're getting stuff done, and you're not really taking in the enormity of the big picture. You're really just dealing with whatever's in front of you over and over and over again. For a healthy person not in constant crisis, you can go into a sympathetic response, a fight or flight state for a period of time, and then you come back down to a grounded state, right? It's like, oh, I'm late for a doctor's appointment. I'm going to hustle. I'm going to grab my keys. I'm going to run out the door. I'm going to do this. I'm going to do that. I'm going to block out everything else and just focus on getting the doctor's appointment on time. I'm running. And then I get to the doctor's appointment. I'm safe. Everything comes back down again. When you are in a state of constant crisis, right, such as when somebody is sick, it's not so easy to come back down to a state of safety because there's always this other thing, right? I know for me, when I was a caregiver, my phone was always on, right? And when I was no longer a caregiver, I turned my ringer off. It was such a viscerally different experience to recognize that there was nobody who was going to need me at 3 in the morning. And turning my phone off, I did not realize how much space it took up until I turned my phone off. And I was like, oh, being on all the time, even if you're not doing something, is being on all the time, right? And there's some low-grade hyperarousal that's always happening. So this is what we call too much arousal. And so hyperarousal, when you are spinning in circles, you're going down Google rabbit holes, and what about this, and what about this, and there's no satisfaction, you're spinning and you're anxious, hyperarousal, a powerful place to be, a hard place to get stuck. There are a lot of charts for this that would put hypoarousal above hyperarousal, which is going to say you're going to be in a grounded state, you have a little bit of threat, you go into hyperarousal, right, this fight or flight. If it turns into danger, and you realize there's nothing you can do, you freeze into hypoarousal, right? And that's when you feel like, I can't do anything. I cannot fight this. I have no ability to affect change in what's happening now. We go into a parasympathetic response, which is this immobilization response. This is too little arousal. At this point, we are numb. We are going through the motions, right? We are sort of going on automatic, where we are nodding to people, we are doing all the things, we're probably pretty passive, we're probably just doing whatever it is seems like a good idea to be doing. We're really not taking in from other people, we're not even taking in from ourselves, and we're generally feeling hoped, trapped, powerless, helpless, right? This is the hypoarousal zone. I know during the most stressful times in my life, I was working at the hospital, I'd be in the hospital running around all day long, hyperarousal, getting all this stuff done. I was like super social worker, look at me getting all this stuff done, discharging patients and running around in crises. And then I would come home at the end of the day and just crash out. I would just watch TV and have no idea what I was watching, right? People would talk to me and I would recognize these were English words, but I couldn't really take it in, right? I wasn't really present in my body. I was just sort of crashing out of that hyperarousal zone. And if you do that for too long, right, it's really hard to get back to a state of feeling because it becomes your new baseline. And so going into hypoarousal, these are really important. These are what healthy nervous systems can do. Getting stuck in those states can make it tricky to have a meaningful life in these ways, right? And so the reason I'm sharing all of this when we're talking about grief is there's ways that grief can become the threat. When we become scared of our grief, when we are not sure we can handle the full enormity of our grief can send us into hyperarousal. Our grief can send us into hypoarousal during times when we most really need to be able to connect and digest, right? And so being able to track within yourself, do I know when am I grounded and I'm taking things in and I'm feeling things and I'm cool? When am I running around and I'm anxious and what about this and what about this and what's gonna happen next and what am I taking care of? When am I like, I can't do anything. I'm just gonna go through the motions, get everything done. And how do I sort of bring myself back down to these grounded states? For many people, right after grief, right after a major loss, you will be in a parasympathetic response state for a while. You're sort of in shock, right? You're going through the motions, you're taking care of the paperwork, you're doing all the things, you're vaguely sad, but you're not as devastated as you thought you were going to be. Something feels vaguely off, right? These things will happen. There are people who spend so much time before a death and hyperarousal of like, he's at the hospital, what the doctor doing, what tests are they gonna order, and what does this mean, and how are we gonna call the nurse, and all these things are gonna happen. And then the death happens and they're just sort of numbed out. I thought I'd be more devastated. I thought I'd be crying more. Is there something wrong with me? Why aren't I more upset? And this is a very protective place. I see a lot of people nodding when I'm saying this, so it sounds like this is resonating for some folks. And this is fine, right? If this is where you are for a while after a death, if you're functional and you're eating and you're taking care of yourself and you're not making huge life decisions or operating jets or something, it's fine, right? But it's important to recognize where you are so you can make sure that you're taking care of yourself and understanding what all this means. So this is the window of tolerance concept. I want specifically to understand this in the concept and the construct of what it means to go through a prion disease degenerative process as a caregiver, as a family member, what it means to go through the death, and then what it means to carry your grief with you. Because the nature of the illness is going to drive how your nervous system can take it and cope with the things that are happening. So how do we cope? How do we understand grief? This is really the best model of grief. I think most folks know about the 5 stages of grief, which are generally sociologically very important, but wildly misunderstood. They are meant to apply to people facing their own death. They're meant to be not somebody else's death, and they're meant to be descriptive of different things you may go through, not a prescriptive checklist box of all the, this order of operations and things. I think grief gets so overwhelming, folks are like, they want to latch onto something to help them organize and make sense. I would say the dual process model of grief, which is up here, there's a lot of different other, again, if you Googled, you'd find 100 different ways to draw this out. I like this one because it seemed friendlier and less intimidating. The dual process model of grief is, I think, a really useful way to understand some of what you may be going through and to help you organize it and hopefully take some of the shame and some of the fear out of the experience. I think folks have a lot of belief that grief should be a linear process where you start out being like super sad and then you just get like less and less and less sad over time, which is anybody who's ever been sad knows that this is never how it goes. It's never a linear process, right? And so what we want to do is normalize that. It's not, because if you have a linear progression of grief, then every time you are more sad, you feel like you're going backwards, right? I'm doing this wrong. I should be over this. I was already through this period, right? There starts to be a lot of self-judgment and blame. And what the dual process model basically says is everything is forward and everything is iterative. We're assuming a linear space-time continuum for the sake of this, because it makes life easier, right? We're going to say everything is iterative. Everything is inclusive of everything that has come before, and there's no going backward. And what is normal and typical is to dose out grief and dose out avoidance. And these are both healthy. And so sometimes you are in this loss orientation. What did I have? What was it like before? What did I lose? What are the memories? What was my life like before the death? Sometimes we are immersed in that experience. We have a wave of grief, we have a trigger, and these things happen. Sometimes we're in restoration. What is it like to live without? How do I make new relationships? How do I make new connections? What is it like to carry the grief with me, but in this way where I'm focusing on my new connections? And that the normal, again, air quotes, typical, healthy, adaptive thing to do is to oscillate. That especially right after a loss, around anniversaries and holidays, you're gonna oscillate 100 times in a day. Where like 1 minute, you're gonna be crying and sad. And then like the next minute, you're like fine. And you're like, wow, am I a crazy person? This is what all my patients say, right? And then they're walking down the street, and I'm in New York, so you all get New York references, right? And they smell hot dogs, and the hot dogs remind them of something. All of a sudden, they're crying on 9th Avenue, right? If you're a New Yorker, somebody's always cried on 9th Avenue. It's a thing, right? And then they're crying, and then a few minutes later, it's like it passes, and it's like it didn't happen, right? Or they're just in the grief all the time, and they feel guilty when they're thinking about, well, what happens next? Well, what if I want to date again? Or what if I want to live a life with that? What if I want to go on vacation? Oh, no, I feel too bad. That's wrong. I should only be sad. And so this ability to normalize this oscillation between and recognize that the oscillation is how you move forward. Forward looks like oscillation. Forward looks like have a foot in here and have a foot in here, right? Moving forward looks like sometimes you need to avoid your grief. Sometimes you need to pretend for a period of time like the grief is not this big, huge thing that happened to you. And that is okay. And sometimes you need to pretend like moving forward is not a thing you have to do. And this sort of dosing out avoidance and approach is what we would call healthy grief. And so for a lot of folks, once they recognize like you should oscillate, you should go back and forth, and it can look like whatever you want it to look like. Over time, people tend to spend more and more time in restoration, but especially around anniversaries, holidays, major life events, you're gonna have a lot more oscillation, a lot more back and forth. And the best thing you can do is tell yourself, this is my nervous system's way of taking care of myself. This is how I'm making sense of what's happening. This is my nervous system's way of trying to dose it out so I can take it in and integrate it and make sense of it. If you're going back and forth, you're doing great. If you're just staying in one place, one of these areas, you're probably still doing great, right? But just normalizing this is not a linear progression of grief. It is okay to go back and forth. It's okay to spend a couple weeks not thinking about your grief at all and then have it hit you really hard out of nowhere on a Tuesday. And like, this is it. And this is just what you needed right now, was to be deep in your grief for a while, or vice versa, whatever that looks like. And so this dual process model of grief, I think, is a really good way to help people organize. And this is there's like research and literature and theories and stuff about this, but I will tell you, I teach this to my patients because I say, I'm not with you at 2 a.m. when you're up and your mind is racing, you're overwhelmed, or you wake up in the morning, it's a punch in the gut when you realize, that this person is gone. I'm not with you in those moments, but I still want you to hold on to this idea of what's happening and understand what's going on. So the dual process model of grief is one of the ways that we might make sense of it. I was really enjoying the clip art. One of the things that's important, I know I sort of touched on this already, is recognizing that grief does not start at death, right? Grief starts at the moment when everything changed, when there started to be an inkling that everything is different now. And even if you don't know what it is or how it's going to go, that's when the after starts. That's when the grief starts, right? And especially for something where, for many of you, there might have been a period of time when there were symptoms and you didn't know why or what it was. You just knew that something was off, but you didn't know why. For some folks who have family histories and things like that, you might have known why. But recognizing the grief starts when there is an after. When whatever sense of control you thought you had, whatever direction you thought life was going to go in changed, that is the after. And so recognizing that we need to start honoring our grief really from the very beginning. And not just the grief of death of the person, the life I thought I was going to have, the relationships I thought I was going to have, the control, the autonomy, the direction, the meaning, the purpose, all of these things change. So what are some of this for folks who were here last year, this is one of the same slides. What are some of the losses that come up with CJD? And these might be true for other diseases as well, but just to name, because I think what happens for death losses is we look so much at death as the main loss that it's hard sometimes to recognize that we are also adjusting to a world in which all of these other things have changed as well, right? And we need to honor that this is exhausting and this is consuming, and there's all these other things that had to change in addition to the loss of this person, the loss of this relationship, right? So these are just some of the losses, and my hope is that by naming them, it's not bumming you out more. My hope is it's helping you name and organize what's happening so that you can recognize within yourself, oh, that's why it's so hard. Because this is the work I'm doing in all these different areas, right? If it is bumming you out, go to a happy place in your head. You have my full support. So what are some of the losses that come with CJD? Some of these may resonate for some of you, some of them may not. Roles and other milestones, right? When somebody in your family is sick, when somebody in your family is dying, your roles have changed, right? If you were a child, you have now become a parent of sorts, right? If you were a spouse, you have become a parent of sorts, right? There's other roles in your life you don't get to have because a lot of your energy is going towards these roles. And so roles and milestones in the life you thought you were going to have, a lot of these things change. And this doesn't mean that grieving the loss of these other things you get to do means that you made a mistake, right? If somebody is sick and it's meaningful to you to devote so much of your life to caring for them, maybe that's a choice you would make 1,000 times over. Maybe that was absolutely, under the circumstances, the right choice. And it's not without its costs, right? And we can honor the losses we've had without thinking that we made the wrong choice, right? And so there's losses of other roles, milestones, the life you thought you were going to have, especially with CJD, so frequently out of life cycle, right? When I'm working with people whose person is in their 90s, it is still sad, but it is a different sense of loss. The horror is not usually quite so profound because there is a sense of people in their 90s are probably going to go from something, right? Or everyone's going to go from something, but it's a very different experience. Out of life cycle means, for many of you, your friends and your neighbors and your colleagues and your peers are not going through what you went through, right? And that's a very different experience, right? It can be a very lonely experience. And there's a sense of all the life that didn't get to get lived. Right? The person as you knew them before. We have this thing with neurodegenerative disease called ambiguous loss. And ambiguous losses are tricky, right? Because when somebody dies, there's a day they are alive and there's a day they are dead, and you can name it. And there's an anniversary of it, and you'll get a casserole, and you'll get a hug, and you'll get acknowledgement, right? You know when this is, or whatever casserole is in your community, right? I'm from the South, you get casseroles. What happens when they're physically still present, but psychologically no longer the person that you knew? And you are still going towards them, because they look like the person you've always known, and you have this devotion to them, but they are no longer a part of your relationship. They don't hold on to the history of your relationship. They may not know who you are. They might not relate to you. They might not reach for you and give you a hug, right? Even if they're still physically present. And so the person as you knew them before, even as they are alive, it is a tricky loss because it's a letting go and holding on all at the same time, right? Going towards somebody that looks so familiar and yet feels so unfamiliar, right? And these are losses that are hard to grieve because the person is still there. And so intellectually you might recognize it, but these are one of the hardest things for people to really reckon with. And a lot of times it's not until later that you look back and like, wow, I said goodbye to them 100 times over, like 1,000 times over. For many folks, having to be an expert all of a sudden in healthcare, for those of you who are not actually experts in healthcare, where all of a sudden you have to make decisions about testing and treatment and which doctor you're going to do and which medication you're going to try for symptom management or what direction you're going to go in. You have to advocate and push and advocate and push and do all the different things. All of a sudden you have to be an expert, and everyone's relying on you to make these decisions when most of us, I mean, even myself, who is quite healthcare savvy, when it's my own family, it's overwhelming and I don't know what to do and I freeze and all the same things that people do. So having to be all of a sudden be an expert and have all this responsibility without a lot of preparation while you're trying to grieve all these other things. A lot of the losses, control, predictability, security, and connection, these are usually pretty self-explanatory but worth naming. A lot of folks, one of the hardest parts is that they lose their existing connections. Their friends and their family and their community members don't get how grueling it is. They don't get how painful it is, or they don't have the bandwidth to stay with the pain for very long, right? They can stay for a couple days, a couple weeks, and then they sort of fade out and start saying platitudes like, God never gives you more than you can handle, and look at the silver lining, at least. Nobody in grief should say the word at least. There's no at least for anything, right? And so the loss of these connections that used to be so supportive, right, can be another one of these major losses because people don't know what it is. They don't know how to help. And very few people can sustain the emotional intimacy for this for more than a couple of weeks. Very few, for many of you may have found this, and which is why it's wonderful that you all find each other. A lot of folks lose a relationship to a higher power. How do I make sense of a world in which really bad things happen to really good people, right? Where I can do everything right and I can't protect people from going through things. Income and career, a little more straightforward, and time to grieve losses. right? When you are caregiving, when things are changing, when the treatment is happening, when progression is happening so rapidly and you're figuring stuff out and you're running around, you don't always have time to really grieve losses. So one of the questions we're asking ourselves, where do I hold grief in my body? This is another one of the ways we can sort of check in with ourselves. I'm going to go through these briefly, just looking at time so we have more time to chat as a group. Some of the struggles of grief specifically related to prion diseases, finding others who get it. It's a little bit less of a struggle for you all. You were in this room because you found others who get it, but you can imagine people who are not connected to a community of people who get it and they have to try to explain it, right? How isolating that can be. The trauma of diagnosis, when you don't have a clear, like here's a blood test and this is the thing that you have, right? When you have diagnoses of exclusions or diagnoses of syndromes and clinical presentation of things and different stuff like that, you know, up until that point, up until the point we have something very definitive, that the whole process is quite traumatic. Coming out of survival mode is really hard, right? Everything happens pretty quickly, pretty rapidly, pretty aggressively, and all of a sudden it's like there is a threat, there is a danger, and I have to be in this emotional lockdown place. Integrating these ambiguous losses, all these things where people are physically present but psychologically absent, and these unfinished narratives. And these will all be on the slides. My apologies, you didn't get them in advance, but you will have them afterwards. This is the big question. This is a red panda. The IT guys and I did a crowdsourcing. We believe this is red pandas. We checked. We're pretty sure. One of my favorite things to have you ask yourselves, especially those of us socialized as women, whatever you're doing, what can you do less of? Right? What can you do less of? It could be self-blame. It could be a over sense of responsibility. It could be emotional labor for other people, actual like physical labor for other people. What can I do less of? Can I lower some of my expectations of what I think I should be right now? What can I do less of in my grief so that I can honor and allow space for this grief process to happen? And whatever it is you think you're doing, pick 2 more things and take them off your plate, right? Physical or physically, I mean, in a logistical sense, you may not have that luxury. Emotionally, everybody can release something, right? What can I do less of in my grief? When you are dealing with somebody who is sick, you have to do more. You have to anticipate what are they feeling and what do they need and how do I advocate and how do I get and are they in pain and are they hungry and are they thirsty and do they need this test? Do they need this medication? Do they need this doctor's appointment? Do they need to be changed? What's happening? You always have to be doing more. In your grief, give yourself the space. Ask yourself this question, what can I do less of? Right? This is actually, a yoga teacher said this once in class, and I was like, oh, I'm stealing this for grief, because this makes sense too. In this moment, what do I still have to do everything that I'm insisting on myself to be doing right now? So this is a question I want you to ask yourselves constantly. What can I do less of? The answer should never be, take your prescription medication and feed yourself and take a shower, but if there's things that have some flexibility, do those, right? Wear seatbelts, look both ways. Don't do that less. So this is my advice for coping with CJD grief, right? One is be in community with people who get it when you need that. And let yourself be in community with other people for reasons other than grief too. Sometimes you will need to be with people who know everything that you went through, right? Your CJD folks, your caregiver folks. Sometimes you need to be with people where that's not on the table. And they are relating to parts of you that are unrelated to grief because you need to exist in a world where that's not the main thing. For some of you, you might spend more time in one end than the other. Let yourself be in community with both, right? Wherever you are. Name what you have lost, even if you only name it to yourself. But name it, acknowledge it, honor it, and hold it lovingly. It doesn't mean you have to love everything about it. It doesn't mean you have to accept it. I don't know what acceptance means. I'm a big fan of raging out about things. I'm here for all of that. But hold it lovingly, hold it gently, the fact that you have lost it, right? Be kind to yourself about how you're coping. I tell my patients, meth and murder are bad choices. Everything else is probably okay, right? However it is that you're coping is probably okay. If you're concerned, you can ask a professional, but if you're judging yourself about how you're coping, you're probably just trying to distract yourself from how you're coping, right? So be kind to yourself about how you are finding safety. You might find safety in distance, you might find safety in closeness, you might find safety in wine, you might find it in cookie dough, you might find it in activity, you might find it in sloth. Be kind to yourself about how you're finding safety. This next one is very important, and I'm going to repeat it twice. Most people in your life will say very stupid things to you in your grief. Well-intentioned, but very stupid things to you at some point, right? Let people be imperfect in their execution. Accept imperfect connections. You will need to layer them, right? Because people will say dumb stuff and you're gonna have to, and you text somebody else in this room and they will understand, but take in the love and take in the fact that some human being sees that you are suffering and try to connect to you, right? No connection is going to feel imperfect when you have a giant hole in your heart, a metaphorical hole in your heart, right? So be kind to others who do not show up how you need them or people who cope differently than you do. There are some people who cope by never talking about a thing. That is their way of finding safety. You don't have to like it, but be kind to them and accept that this person may still want to be in your life. If somebody's being toxic and mean to you, don't put up with that. But if somebody is trying to love you and trying to care for you and just it's not landing, try to take it in anyway, right? This is the best advice I can really give you for the grief because it's very isolating if you hold out for a perfect connection, right? Recognize that while nothing will fill the hole, I'm not going to pretend like it will, you can create a life worth living. For many people, this is one of the hardest parts of grief, that there's a life worth living outside of the one you had planned, right? Even if it's not how you expect it to be, it's okay to grieve that. This next one I stole from AA. Do not compare your insides to other people's outsides. Well, this person's coping better, and this person's doing this, and this person doesn't seem as upset as I am. Very few people look like a hot mess on the outside. Almost everybody feels like one on the inside, right? Don't compare your insides to other people's outsides. Don't hold yourself to a timeline. There's no timeline, right? The research on you should be over things in 6 months, that's a threshold for when there's predictive value and sensitivity for a test in predicting problems long term. It is not a timeline to say everybody should be done grieving in 6 months. Nobody's done grieving in 6 months. It's not a thing, right? There's no timelines. If you are eating and you are hydrating and you're reasonably functional, even if you're still upset and you're crying all the time, don't give yourself a timeline. Let yourself have your feelings without the pressure of being over it or having to do something about it. Sometimes you are just going to be messy, and you're going to be a hot mess, and you're going to have your feelings, and it doesn't matter if you should be over it or this, I knew this was happening, why am I so surprised? It's been 5 years, shouldn't I be over it? None of these things are true. These are just narratives we're making up to make our lives harder. Let yourself have your feelings. Okay? I think I have 1 or 2 more slides. In my hardest moments, what do I most need to know, hear, and remember? When you are feeling your most powerful and expansive, write yourself a letter for when you are feeling your most weak, of all the things you need to remember. Is it that you are loved, that you're connected to? Is it that you always did your best, and you took care of the person as best you could? Is it that it is okay to find a life worth living? What is it that you need to hear? I don't know what you want, right? You're going to know this within yourself. But think about literally writing down, when you feel most connected to your grief and most connected to your sense of meaning and purpose, what are the things you know to be true? Write them down so that in those moments when you are bereft and you are overwhelmed and you are laid bare and you are feeling totally unmoored, remind yourself of the things that you know to be true. And that's going to be very personal for each of you, right? For each of your own experiences. When you're considering more care, I'll go through this more briefly so we have more time to chat. For individual, the community is going to be enough for most people. Some people may want individual therapy or support groups or bereavement groups. Individual therapy is when you have a lot of other traumas or things happening in your life. You really want to reflect on long-standing relationship patterns and dynamics and unresolved feelings, all these things coming up. If you just do better one-on-one when somebody's really being slow and careful with you, if you get overwhelmed by the experiences of other people, individual therapy is a great way to go. If you are at risk of destabilization, you're going to hurt yourself, you're not going to be able to eat or drink, you're not going to be able to take care of yourself, you need one-on-one support. If you have active substance abuse or an impairing mental disorder, you always need one-on-one support, right? 85% of folks do not need grief therapy to get through their grief. They did actual research on this, right? That said, if you want the extra support, go for it, right? These are the patients I see. They do well. They do well with support. For a lot of folks that come in for individual support, the grief sort of highlights more of a long-standing issue or things that were sort of in place before. If you're trying to find a grief therapist, this is my advice to all of you. A lot of therapists say that they know grief because they know depression. They're not the same thing. They're completely different animals, right? And so one of the things I would encourage you to ask your provider is, how do you treat grief differently than depression? If they cannot give you a good answer, don't go to them. If they say they treat them the same or they give you some, oh, I just listen to your feelings about it. No. If they can give you any kind of a good answer, it's worth a shot. Another great question to ask is, how does the provider see goals? What is the goal of our work together? If it's to get you to grieve less, don't see that person, right? If it's to fix your grief, this is not a problem to be fixed. And so these are questions to ask if you're trying to find a provider where you are and you want somebody who has some expertise in grief. If you were doing supportive bereavement groups, I'm just going to list them up here. You can follow it up later. These are some of the different criteria you can look for, the different ways that we might understand support in bereavement groups. I think community is really important. That said, some groups can get folks who are, like, only the folks who are really stuck in their grief and really deeply unhappy sort of stay in the groups for years and years and years. And then new people come in and get horrified by it, and then they leave. And so if that might be the case for you, you find a short-term group that runs for 8 or 10 weeks. If you really just want people who will be with you for the long haul, you can find the groups that are open-ended, right? If you want groups that are going to have a little more social control, you find one run by a professional. If you want more of a peer vibe, you find one run by volunteers, right? There's all these different things we're looking for when you're trying to figure out the right kind of group. These are some grief resources. It'll be on the slides. Just books, kids, websites, things you can figure out. And my contact will be up there as well. So we have about 8 minutes. I promised you like 20, so we might go over like 5 minutes. Yes? Is that okay? I'm putting you on the spot, Debbie, sorry. We're going to go over for a few minutes, but I'll be here. And so I just want us to take a moment and check in, because you got a lot of information, a lot of things that might have been helping you recognize or organize some of your internal experiences. For me, being a professor of grief, I'm always interested in the research as much as the clinical experience, and a lot of the things I've shared are sort of informed by best practices, not just the sort of lived experience. And so I just want to acknowledge making the shift that for many of you, hearing all of this might have been evocative, it might have been relieving, it might have been terrifying, it might have been boring. I welcome all of these responses, whatever it was. And so if folks have questions, comments. So first one is, are there differences by age? I only work with adults, and so I'm only going to talk about the adult spectrum. Yeah, that's fair. But there are differences by age and children. I just want to be clear, I'm not talking about those. I don't know what you do with children. But for adults, you're looking at risk factors. The older folks there are some folks who would have more confidence in navigating loss because they've had so many losses, they know they can survive them. There are some folks who have had so many losses that losses become compounding, and they become more overwhelming and more debilitating. If you are older adult, you are more likely to have physical frailty and social isolation and lack of access to resources, and all of these will complicate your ability to build new connections, and those could be risk factors for grief. But if you are younger, you are less likely to have peer support, and that could complicate. And so what I will say is that the risk factors change with age, but I don't know that there's an overall certain people do better than others. Generally, the more socially connected you are, the more resourced you are, and the fewer other psychosocial stressors you have, the better you will do in your grief. Probably not surprising to anybody. But the other risk factors are really going to be pretty person-specific. And that's your first question. The second one is about gender. There's some research by DOKA, D-O-K-A, on intuitive and instrumental grief. And they've basically shown that grief is impacted somewhat by how the gender in which you were socialized, but a lot by your sort of social standing, right? And so to the extent that people socialized as men have this sort of stereotypical instrumental grief where I'm a fixer and I'm a doer and I'm not going to have my feelings. I'm going to pull myself up by my bootstraps or whatever terribly toxic things we teach the boys and men of our society. And that women are taught to have your feelings and cry and be sad and have cookie dough and be hugged by your friends and things like that. And the research shows that both types of grief are equally good outcomes, and what you look for more is the goodness of fit of your grieving style to the person, right? And so if you are somebody like, for me, if I'm grieving, I need to have all my feelings. I want you to hear all my feelings. I want you to hear them twice. I want you to give me the cookie dough. That's what I want. And so if I try to avoid my grief by doing things, I'm going to be thwarted in my grief. And so it's less about gender and more about goodness of fit of your style. But I would say the factors for resilience in grief are less driven by gender and more by the degree to which somebody's grieving style suits them or suits their community. And then the piece about sensitivity, I don't know if I could give you a 2-line answer for that one. Yes, people probably have more feelings after they're grieving. But they could go the other way, right? They could get so tired of their feelings that they shut them down and they stay in a stuck place. I could see it going either way.
So it's not abnormal either way.
We sort of look less for like statistically abnormal and more for, is it functional? Is it adaptive? Right? Like, does it work? Is it flexible? right, is sort of what I would look for more. So some of the signs of resilient adaptation, George Bonanno does the work on resilient adaptation. He wrote a book called The Other Side of Mourning, The Other Side of Sadness. I'm off by a word or two, but most of those words are correct. And there's signs of resilient adaptation, which is, can I imagine a life that's potentially meaningful? Can I restore connections and relationships? Can I resume work and leisure activities? Can I rework my relationship to the person who is deceased? And none of the signs of resilient adaptation are, am I still crying every day? Am I still upset all the time? None of those have anything to do with whether you adapt. It's really more of this existential ability to reorder your object relations, like your ability to connect again. So there, you got all my research and like a little soundbite. Thank you. Yes, you had your hand up with a cool emotional baggage bag. Very nice. You know, I think I realize I should have been repeating the questions back for everybody. Sorry about that for the other ones. But, your question is, if I'm understanding, I'm going to reframe it, is, the things that we do to cope in the short term, right? We shut down our feelings to cope in the short term. What happens if we stay stuck in those places, right? Where we recognize this is not a usual range of emotion, right? And the question is, we recognize that we are in some kind of hypo-aroused state. We're not really feeling our feelings. We're intellectually acknowledging a lot of things, but maybe the feelings are blunted or muted a bit. If you're feeling like you're sort of stuck in those places, that's where one-to-one therapy, I think, can be really helpful to somebody really see you and attune to that and help you very slowly increase your capacity to feel things again. If you try to do it on your own, you're going to like white-knuckle your way through it and sort of shove yourself one way and shove yourself another way. It's probably pretty exhausting. There's a good book, The Body Keeps the Score, that I think explains a lot of this pretty well. It's very overwhelming for folks who have a trauma history, but it can explain a lot of it. But I mean, you can do some research into the polyvagal theory and the hypoarousal and see what they have. But a lot of it is the grounding exercises. Is how can I bring myself back down and reflect on my feelings and notice my feelings and increase my capacity, recognizing that a hypoaroused response is a response to danger. And if I can recognize what am I interpreting as the danger, and can I rework that narrative inside so that it's no longer a danger and it's just this annoying thing I have to deal with, right? Then you can hopefully increase your capacity to stay in this grounded place longer. Easier said than done, but that's a great question. I'm really glad to hear that, and I'm very sorry about your wife. I'm glad you're looking out for a connection, and I think, my hope in sharing this and making this schlep down here from New York every year, or at least the last 2 years, it's that sometimes naming it makes it easier, a little more gentle to hold it, right? Because you can know what's happening, you can name it, you can organize it, you can hold it with a little more love, you can take in a little more support around it. And so if you are watching it, I really thought nobody would watch it. This is great to hear. But if you're watching it and you're taking something away from it, that's very meaningful, and I'm really glad that you're seeking out connection. So thank you for sharing.
We send your video out every single Friday. Yeah, multiple times a week we send it out. So who's watching it besides your mom?
Okay. She'll be so pleased to hear that. Yeah, I wrote a book. It's a textbook. You're not going to want to read it. And I remember I sent it to my parents, and they were like, do we have to read it? Everything you write bumps us out. I was like, fair enough. Yes. Yes. Are they struggling? The question is, how do you help people in your family who are still struggling? Usually when somebody's asking that question, it's because they're struggling in a way that's different from yours. Because if they're struggling exactly like you would know what to do. And if they're struggling in a way that's different, it's probably causing some friction. Yes? Okay. I think this is where, they're so situation specific, but we're understanding that people grieve in a way that helps them find safety. And if you can reframe what people are doing, not as they're avoiding their grief, they're being cold and callous, they're just trying to move on, they're whining all the time, they're crying all the time, whatever side of the spectrum that people are on, that people are trying to find safety. And if we can look with empathy and compassion to, this is what this person needs to make sense of the world. This is a way that they have a recognizable sense of self as they move through the world. And sometimes it's a little bit easier to give people a little bit of grace in that. It's different if you were concerned about how they're coping, like they keep punching people in the face. And there's like an actual, like, you need to do something, right? That's do something. Assuming it's just like a difference in grieving style, it's really about making the adjustment within yourself. One of the hard parts of grieving is that initially everybody all comes together and like, we're in this together and we all miss grandma and this is the thing that's happening. And then usually within a couple of weeks, everybody starts grieving in their own way and it starts to feel a little bit more isolating and sad because if you're not grieving in similar ways, you don't feel like you're in it quite as much. And that's why I would say find people who grieve like you, right? And grieve that too. It's hard. Yeah. Very few people go on like punching sprees, to be clear. I just want to differentiate, but yes.
It would feel good if they need though.
And I would encourage you to engage in that daydream as long as it stays a daydream. Yes.
So I would concur with, is that
Yeah. So your question is there a magical incantation of words that works for all people at all times in response to loss? Yes. I will say I used to work inpatient hospice. We had a death a day for 2.5 years. And I was relating this earlier to another colleague here. And I was really cool right up to death 700 or death 800. And somewhere around death 800 or 900, I just went over the cliff and I was like, this is too many deaths. I can't handle this. And so what I will say is that I've made a lot of bereavement calls in my lifetime, right? I've expressed a lot of condolences. I stumble all the time. Like if one of my friends says to me, oh, I lost somebody, my response is, fuck. Sorry, can I say that? Right? Like, I don't know. Like, what is my response? It is a curse word, right? There are very few things because there are people who want to acknowledge it in a big way and there are people who don't want to be imposed upon to have a big performative experience. And what I will say is that being slow and careful in your response and being intentional with your wording is going to be more important than your actual words. And so something that sounds like, oh, I'm so sorry to hear that, is going to land like you don't care versus, whoa, I am so sorry to hear that. And so I would say focusing on your energy more than your words is going to be helpful because words are going to be different for everybody. I mean, like, sucks to be you. Don't say that. I don't know. Or maybe you would. If you said it to me, I would appreciate that. I would find that funny. So, but yes, it's awkward. And this is the hard part. And this is why you have to be kind to people who are awkward with you, is because I'm awkward with people. I am a professional grief person. Like, I write books and I teach, like, I do grief, and I don't know things to say half the time. Because I just, there's so much pain and suffering. Like, how do you acknowledge that with words? And so I would say you acknowledge it more with your energy. And also, many of you may remember in the acute phases of grief, how many of you remember what most people said to you? Unless it was like egregiously terrible, it probably all got mushed into a big lump of like things that people said that were nice, right? You're not really taking a lot of it in anyway, so. What I would say is that the best thing to do is be the person who shows up after 6 weeks. Everybody shows up for 2 weeks. Some people show up for 6 weeks. Nobody shows up after 6 weeks, unless they're like your best friend. So the nicest thing to do is keep showing up. It's Father's Day, it's Christmas, whatever it is. I'm thinking about you. Keep showing up. That's the best thing you can do. I hope that was helpful. Yeah. I'll take one more. Yeah, so we hold grief in our bodies first, right? Our sense that we are grieving is a thought that happens many nanoseconds after our bodies have this physiological experience of grief, right? We have this separation anxiety, this fear of being separate from, that our bodies are just in this mortal place. And honestly, like, it's your daughter. Like, there's not a world where this is going away, right? And so with holding it in your body, figure out how to release it in your body is really important. This is my least favorite advice to give people. And I apologize in advance, but cardio really helps. Well, what I was going to say is that 30 minutes of cardio metabolizes like a day's worth of cortisol. And so keeping yourself moving is really helpful. It takes some of the tax away from your body from having to process all the stress hormones. And I hate this advice because cardio is terrible, right? And it's very helpful. But figuring out ways to physically move it through your body can be really helpful. Acupuncture, massage, going for walks, other things that can be really physical, progressive relaxation where you're like tensing and releasing things in your body. But even when the notice things in your body, talk to it. You have a pit in your stomach, put your hands on the pit in your stomach and talk to it and acknowledge it and send it love and send it warmth and send it air. And just understand that this is grief that you cannot possibly put into words is what's being held in your body. And it sucks. And so cardio is not going to help a lot, but it might help a little bit. And I'm sorry, on so many levels. Sure. So it's 5:11. I probably abused the end of my time of when I should have been here. But thank you all for coming and being part of this conversation. It's so meaningful for me to be here. And if folks have questions, I always like to talk shop. I don't know, where was it? If folks have questions, that's my cell. You can text me, you can email me. I'm around. You can find me. I'm the only Dr. Abigail Nathanson on the internet. But thank you all for being part of this conversation and welcoming me into your community. So, thank you. Thanks.